Things are changing here at the Norwich base of what used to be known as the Norfolk Family Practitioner Committee. Building work to develop a suite of new offices started on the Duke Street site in February 1990. Now completed, these additional premises will help to implement changes within the newly named Family Health Services Authority, building an efficient, more effective service for Norfolk primary health care. In this programme, we shall be looking at how the Norfolk FHSA is now structured, who does what within the organisation, and what this all means to you. But first of all, let's take a look at how things used to work.
This brings us then to item 7, the minutes of the last meeting.
Up until now, the organisation's main responsibility was to ensure that contracts and payments were in order, to provide support and advice, and when necessary, to investigate complaints. With some 30 members, the committee represented a rather cumbersome controlling body. Now, a new streamlined authority of 10 members, including General Manager Ray Wilcox, has been set up under the chairmanship of Mrs. Joyce Hopwood. Back at St Mary's House, General Manager Ray Wilcox outlines the philosophy behind the new FHSA.
You have to remember that the health service has been in existence for 40 years now, and these are the first significant changes that have been introduced as a result of a succession of white papers from the present government. The idea of a smaller Family Health Services Authority is to give a more strategic view to the way the services are managed and developed. And you have to remember that we're spending £100 million of public money in Norfolk this year on the family practitioner services. So the idea is to get an authority that has a strategic view, that brings in people from the outside business world to bring their experience to bear on the way the services are managed, and to provide a smaller authority, a smaller number of people to make the decision-making sharper.
A considerably more streamlined management structure has been developed based around 3 separate area teams, whose area managers are directly responsible to the Deputy General Manager. Ray Wilcox goes on to explain.
We knew that we would have to look again at how the organisation was structured within St Mary's House. While we were an organisation that was primarily involved in paying general practitioners, investigating complaints, we could live with a centralised bureaucracy, as it's called. And that meant that we could stay within St Mary's House, and we could split the function of the organisation into finance and registration and contracts. With the new contract for general practice, we need to be that much closer to general practice, to work with them, to help people meet targets, and to look at ways of improving the way that primary healthcare services are delivered. For that reason, we decided that we needed to split the county into 3 distinct areas and introduce 3 area teams. And all of those teams will be responsible for the whole range of services that any general practitioner would expect from this organisation. And the team managers will be charged with the task of making sure they relate to each of the practices in their patch. We've been fortunate that we've secured 3 new appointments as area managers, people from outside the organisation, but also people with knowledge of the health service. So we think this will be a very positive move in improving communication between the FHSA and general practice.
The 3 area managers are broadly responsible for the planning, development and management of family practitioner services within their locality.
Hello, Catherine Squire, can I help you? Oh, hello, Dr. James.
Responsibility for the central area is held by Catherine Square, whilst the western area is handled by Robert Jones, and completing the trio is Michael Stannard with the eastern area. I asked Catherine to explain the structure and working of her area team.
Well, the basic philosophy is that each of the 3 area teams have the same structure. So going in terms of hierarchy, there's the area manager at the top of the team. Below them is an operations manager. We also, within the office, have the resources of a developments manager. And at the moment we only have one of those in post, and the responsibility of that individual is to make sure that we're looking at the developmental aspects of the new GP's contract and other development work generally, so that the developments manager and the area managers can work quite closely together. So we've taken the decision earlier in 1990 to reorganise into area teams. These became operational on the 1st of July this year, which was 3 months ahead of our anticipated schedule. And at the moment, we would very much ask the contractors in general to bear with us, because most members of staff are going through a great learning curve while they actually take on different responsibilities, new areas of work, and generally get to grips with various aspects of these 2 new contracts.
Providing support to the 3 area teams is a selection of specialist support departments: health promotion, medical advice, planning and information, organisation development, finance and business management. In its first white paper promoting better health, published in 1987, the government made it clear that it was seeking improvements in primary health care and set out the following key objectives: raising standards of care, improving value for money, promoting health and preventing illness, and making services more responsive to consumer needs. The 1990 GP contract embodied these principles and for the first time focused GP's attention and accompanying payments on health promotion activities. The 1989 document Working for Patients has developed the principles set out in the first white paper and will be implemented in April 1991. The NHS and Community Care Act became law on the 29th of June 1990. Enabling these 2 white papers and supporting documents to be implemented by the government. The major thrust of all recent NHS legislation is to increase consumer choice and to ensure greater value for money. The FHSA is the vehicle charged with the responsibility of managing primary health care through the nationally negotiated GP and dentist contracts. It is to this end that the organisation at St Mary's House has undergone such a major course of redevelopment and change. The Norfolk Family Health Services Authority works to give everyone in the county an equal opportunity to live a healthier life by managing and developing the services of doctors, dentists, pharmacists, opticians and others providing primary health care to the people of Norfolk.